Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, this is Lindsay Smith-Rogers, producer of Public Health on Call, and today I talk with Dr. Shariki Kumanyika, a research professor at Drexel University and the founder of the Council of Black Health. The Council, along with the Bloomberg American Health Initiative, are supporters of a new campaign that aims to reverse racialized marketing of foods to Black Americans and encourage youth to embrace healthy eating as a radical act. Let's listen. Dr. Shariki Kumanyika, thank you so much for joining us on Public Health on Call. Operation Good Food and Beverage is a campaign and advocacy movement by and for Black youth who want to reclaim healthy food as part of Black lives. So let's first start off by talking about what's the problem here. You've mentioned obesity rates and food marketing on the website. Can you talk a little bit more about that?
Sure, and I'm pleased to be here. One way to put it is that food marketing is actually one of the biggest health risk factors that we have. The obesity epidemic seems not to be abating, and overconsumption of unhealthy foods is a part of that. 2 out of 5 American adults with a classification of obesity, closer to 50% in the Black population. And with children, it's like 1 in every 5 in general. And then in the Black population, it's about 1 in every 4. So this is a big problem. And the diseases that are related to obesity and other aspects of healthy diet, like heart disease, high blood pressure, diabetes, are becoming higher and are higher in the Black population compared to the general population.
Tell me about the role of targeted food marketing in this epidemic.
Targeted food marketing, well, all marketing is targeted. So we've started using the term racialized marketing because we're talking about marketing that follows the patterning in society where people in certain neighborhoods or easy to identify demographic groups, people who might appreciate getting a lot of food for a low price, are the same people who are targeted with marketing of the unhealthy products, more so than the overall population. I mean, it's a general problem. Most marketing is for unhealthy products. That's where the profit is. But in this society, there's more exposure to these unhealthy ads and other aspects of marketing in Black communities and also Latino communities.
And this campaign, Operation Good Food and Beverage, is supported by a youth advisory panel right here in Baltimore City. Why is it so important to engage youth in this conversation?
Yeah, this is really critical, and there's several reasons. First of all, the risks for these diet-related conditions begin early in life, and adolescence is really an important time when youth are forming their lifelong habits, they're forming their identities, kind of deciding who they are and what they do, and food is a big part of people's personal lifestyles. So that's one reason to start with this age group. Also, youth in general and Black youth in particular are at risk of exposure to the marketing more. So the disease risks are starting, but there's more marketing to youth, and youth are quite responsive to advertising, engaged on social media and so forth. So those are the main reasons. But we also hope that this resonates with that youth urge for activism and picking up causes and speaking out for themselves, so that if we're trying to reach the general public or food companies with this message, youth are speaking for themselves. We're not talking about them.
One of the concepts of that activism, which is on the campaign website, and we will include the website link in the episode summary, talks about healthy eating as a radical act. Tell me more about that.
Yeah, I like that. I actually am a child of the civil rights movement, and I can remember that eating in a different way was promoted as a form of resistance. And so there was some interest at the time in some civil rights leaders and prominent voices for eating more plant-based and eating in a way that would seem healthier than what was going on in the mainstream. But it's also kind of a double entendre because in order to eat in a way that's healthy, you have to resist the mainstream food system and the mainstream marketing. So it is resistance. And so we, did a play on words there. We picked up that concept from the civil rights era.
So you talk about the mainstream food system and this campaign is rooted in Baltimore, but this really is a nationwide public health issue. So what are some other action items you'd like to see? How else can people sort of push back against that system?
Well, I think that we need to change the conversation about what shapes people's eating behaviors and what is the sort of fundamental cause of the disease patterns that we see. For one reason or another, people blame themselves and they blame, it's a personal responsibility argument because at the end of the day, people do make their own choices. But our campaign is that we want a healthier range of choices. So what we'd like to see is a new element to this conversation so that ultimately our messages would spread and most people would realize that they're in an environment where they don't have that much control over the choices they have, especially if eating out and, but also in terms of things that they bring home from the grocery store. So we'd like to see a viral youth campaign because youth are great messengers for sort of managing up to adults, and that food companies, restaurants would hear this message and begin to see that there's profit and reputation building in giving consumers with Black consumers in the lead on this campaign a healthier set of options.
There's a petition actually here against the National Restaurant Association. Tell us about that.
Well, we were looking for something to give the campaign a focus, one of many solutions possibly, but for a campaign, we decided to focus on a particular type of change in the food sector. We chose the National Restaurant Association because they have had some progress with the menu options for younger children in convincing their members, their 380,000 or so members to some of them to pick this up. So we're thinking that a positive approach would be working with a large trade organization like that and figuring out how can we bring consumers and activists and the policymakers, restaurant industry, how can we do something that would actually result in changes in the main menu because the teens are not picking from the kids' menu.
Taking on the food industry is not a small task. What have some of your challenges been?
I think one of the challenges is that we wanted to get celebrities to pick this up. There are a lot of celebrities that endorse products, but they're usually the unhealthy products. And the Black celebrities are prominent in this space. And because Black celebrities are role models for Black youth and other youth, we thought, wouldn't it be great if one or two, perhaps some of those who had been speaking out on social justice issues, would kind of add health justice or food justice, to their portfolio when they're speaking out. And so far, we haven't had anyone join the campaign. We do have social influencers who are talking about this, and some will be joining. But we still believe that there's celebrities there who are not necessarily looking for endorsements with, of unhealthy products, and would, give us a boost in spreading this message. That's the challenge. The challenge is to get influential voices to amplify our voices.
And this is a brand new campaign. It just launched in July. Yeah. So what do you hope to see in the coming months? What would success look like in spreading that message?
Success would look like ultimately menu changes at restaurants as a first step. And it wouldn't have to be at every some of the major restaurants, or maybe even some smaller restaurants around the country, but to begin to change the culture and support the conversation. That's success. It's going to be a while getting there. It's not going to happen tomorrow at the first conversation, but if we can get the conversation going, that's what we want to see, and we will be happy to work with others who have the same goal, so that we know we're not doing this alone.
And how can people participate? How can they get involved?
Well, the website is the home base for our campaign. We download the social media kit and see how to post and tag us on the social media, spread the word, and also, walk the talk. We have a message on there that says change begins with you and continues with us. So a collective approach, but individuals can do something themselves, but also spread the word about the campaign and about the need for options, better options. That's the message.
Dr. Kumanyika, thank you so much for joining us today.
Thanks for having me.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.